Why do you think people are starting to talk more about gut health these days?
So there are two things. One is the philosophical side of it. One is the medicinal side of it. So I'll talk about the philosophical side first. I think as our country has gone ahead, we have actually seen better days. So the financial struggle somewhere has gone down with the middle class, and the purpose of life has also gone down. So what happened was, like, maybe you've seen with your parents, but I've seen with my parents, like my grandparents and me and my brother, we were dependent on our parents. So they were very busy, they were struggling, and they were every day seeing that how they will get do waqt ki roti in Hindi or two times food. Where will they get it? And they were struggling. And in that process, they made themselves financially stable and financially retired now in their 60s. So on our generation, the major mental stress of taking care of my parents is not there. Point number one. Point number two, the per capita income of everyone has gone up. So people who are earning 50, 60, 70,000 rupees a month, they're also okay with the YOLO lifestyle, the Gen Z, you only live once. So you're not looking for saving or anything. So there's a major loss of purpose of life. That what am I doing? Why am I doing? That's point number one. Point number two, the medicinal side. With the corporatization of everything, the tech side, and a lot of people like in Gurgaon, like Delhi, Gurgaon, like Bangalore, these tech sites, a lot of Indian people are working in US time zones, UK time zones, and they are being paid better because when the similar population is paid in USDs and euros in those part of the world, it is much higher. So even when they are paid double in INR, which is more for the person earning, it is far less for the company paying. But that comes with a lot of things because you're working from home. When you work from home, there are no hours. So there's a lot of stress. And capitalism breaks stress by incentivization. You understand?
Right.
Like the more you work, the more you learn. So the stress goes down because the earning at least goes up.
Right.
With these people, it's a fixed income. Their targets. And they're all the time working on the screen. So it brings a lots and lots of mindless stress. They are always irritated. They are sleeping poor. They're not sleeping with their biological clock.
In my practice, I can tell you that every patient with IBS, or almost, I'm sorry, I'll take that back. Every night shift person will have some kind of a GI symptoms coming to my office. You eat at 7, sleep at 10, wake up at 6, 7, align to your normal circadian rhythm.
Yeah, I asked them to live according to the time zone they're working in. Match one with the UK or the US time zone. So that slowly you adapt to that time zone. So even if it's 6 p.m. here, you can call it your breakfast. So you'll be much more in a normal zone with your body because you are at peak alert at 2 a.m. in the night. You will not be able to do it. It will cause problems. Like there was a drug it's still called modafinil. It was used for night shift workers.
Yes.
But it will help you adapt. But if you continuously be on it, you'll not sleep at all.
So what I tell them that is that, adapting a night shift worker job is a choice that you made.
Yeah.
And that could be because of better life, because of better pay. But we need to understand that there's a compromise that is being happening in our body. To make sure the compromise doesn't affect significantly is where your diet plays a major role.
Yeah, it does.
In terms of whatever side effect that you're dealing with working late nights. How many people come with late night shift workers with IBS symptoms to you?
A lot of them. Because, see, we cannot call it a percentage of the society because it's already a bias. People coming to us already have symptoms.
Correct.
So can't call it it'll become a sampling bias. But yes, a lot of people have that. And the people who are not night shift workers, they definitely have a problem with their sleep.
What's the most common symptom that they come to with?
Bloating is very common. Constipation is very common. Increased frequency of stools with feeling of incomplete evacuation is very common. So this becomes very common in our day-to-day life. And we had made some reels and some went viral. So now a lot of patients come to me already with those tests done. So like I have talked on multiple podcasts, and I think it is very important for the platform I'm going on because I think it is purely clinical. That how do I evaluate? See, diagnosing someone IBS is not a problem. But not missing a colon cancer is important.
Correct.
Not missing a stomach cancer is important. Because once what happens is, as a super specialist, if you label someone IBS, you stamp it on the forehead as IBS.
Correct.
No physician, no what you call alternative medicine expert will think anything else. So proper history taking becomes very important. Like I call it the Harrison as teaches us, our Bible of medicine. 7 to 8 red flags. Like it is very important for us to understand that all these functional disorders like irritable bowel syndrome, functional dyspepsia, like irritable bowel syndrome, constipation predominant, irritable bowel syndrome, diarrhea predominant, irritable bowel syndrome mixed, they have to have a long-standing history. You can't have a recent onset 2-week history and call them IBS. That's a red flag. So that's point number 1. Point number 2, all these symptoms disappear during sleep. These people, when they are sleeping, if you actually do sensitize them, I ask them multiple times that why does not it happen in sleep? When you're sleeping, you don't have diarrhea, you don't have constipation, you don't have bloating. Why? You don't have brain fog while you're sleeping. Why? Because your mind is resting. I also ask them, right now I'm taking such detailed history. So when I talk to you, do you have symptoms? Why don't you have symptoms? So you don't have symptoms when your mind is busy or it's resting. You have symptoms when your mind is going around. So that is again very important part of history. Third becomes our unintentional weight loss. Any weight loss now, according to the American College of Gastroenterology and a lot of American associations, more than 5% of body weight loss in the last, earlier it was 10%, now it's into 5%. Unintentional, without any effort to decrease appetite or exercise to lose weight in the last 6 months becomes a very important red flag. Then first degree relative, your mother, your father, your brother, your sister having any cancer. And a bigger red flag becomes a GI cancer. Any colon, any stomach, any pancreas, any gallbladder becomes very important. Then another point comes that do you have any hemoglobin low, anemia, any malabsorption of iron, B12, any loss of iron from the GI? Because as you say, after 50 years, any iron deficiency is a GI malignancy unless and until proved otherwise.
Correct.
So it becomes very important. So a lot of physicians, MD medicine asked me, how did you catch this colon cancer? I told him when you referred me, he was 9 HB. His iron was so low, 65-year-old man. You have to tell him it is a class 1 indication. Right? And last, progressive vomiting, any lymphadenopathy in examination. These becomes the 7-8 very important things. These have to be absent.
These are on blood and stool.
Blood and stool, yeah.
Blood and stool.
So I missed that. Blood and stool or blood and vomitus, yeah. Becomes very important. All these things have to be very, very clearly written down on paper or on his prescription that these are not present.